We bring you inspiring stories from nurses who've turned their clinic nurses who've turned their clinical expertise into thriving businesses, innovative startups, and impactful ventures. Our guests share insights, challenges, and triumphs of merging compassion with commerce. Whether you're looking to elevate your nursing career or embark on an entrepreneurial journey, the Smart Podcast is your go-to resource for motivation and actionable advice. Tune in and transform your passion for care into powerful catalyst for change. Motivation and actionable advice.
A very warm welcome to yet another special episode of the Smart Podcast. Of course, today I am joined by my always co-host, Tendai. Tendai, how was your week?
It was okay, pushing.
Okay, you were working?
No, I'm on leave.
You didn't respond to my text. I texted you. I texted you on Thursday.
Saying what? I saw you last week. I was supposed to even talk again on phone.
It was a text. So you respond to a text and then, so that
If-
we see each other even
If
along the week.
it has money involved, yes.
But you
But
had money.
no business
ready for you.
involved. So when you text me, you have to go direct, say, "Hi Tendai, I have 1,000 for you. Can we talk?" Yes, we're good to go.
How can we meet?
Meeting.
It's just 1,000.
Nah.
No, I'll keep my 1,000 then.
Thank you.
No, but good to see you again. We were together last week when we were at Sunningdale University, back here again on set. We want to speak to two of our good students at the university.
Yeah, good to see you too. And today at least won't be any words like I miss you, I missed you. No, today there's nothing like that. We saw each other last week, so
Let me not see you in the next 2 weeks. I'll be okay.
no problem.
And of course, our dear viewers, this podcast is sponsored by Elitrasmart Medical Supplies Limited, your number one provider of medical attire. So if you're a student nurse, you're a nurse already, working, Elitrasmart is there to make sure that you are sorted and you look good in that uniform. Then you call them scrubs.
We they are white uniforms, which we call them as white toto and blue toto because they are always white. So you can visit our stores. We have 4 stores: Lusaka store, K2H, Pata, and Choma. We open every day 8 hours till 17 hours. So feel free to walk in and buy your uniforms every day. A cleanness is a happiness.
Nice. No, I've seen some of your pictures. You look nice, clean. Yeah.
You've forgotten the other word, smart.
Oh yeah, as always. Yeah. Gladys, welcome to the Smart Podcast.
Thank you.
And Mr. Ivan.
Yeah.
You said Ivan.
Yeah,
With an E.
with an E.
Welcome to the Smart Podcast.
Thank you very much.
So guys, we are happy. We're glad to have you. And of course, we are also excited because we are back here at your university, Sunningdale University. We were here.
The defending champions.
Oh, the defending champions. Yes, because we want to discuss the Smart 25 quiz.
Yeah.
Yeah, and some of the students that participated last year from this university, we are told have exited the university with good grades actually.
Yeah.
When we sat with Mr. Temple last week, he was telling us that Actually, amongst those ones who received academic awards for best performing students, the student that participated in the national in the Smart 24 quiz, those students were among the good recipients of those awards. Yeah, and we want to hear from you on how well we are preparing for this quiz. But even before we dive into discussing the quiz, let's just get to know you a little bit better. Who is Gladys? Tell us a little bit about yourself.
Okay, so I'm Gladys Mwani. From Sunningdale University. I'm in my second year, second semester. Yeah, I'm from Chibata.
No, Chibata.
Yes.
Okay.
The wise man from the east.
The wise man from the east. Okay. Chibata, nice, interesting. I've been there before. I think Elitrasmart also has stores.
Yes, we have a store there.
Interesting. Mr. Ivan, a little bit about yourself.
Okay, so my name's Ivan Monsaka.
Monsaka.
Yeah.
The M-U-N.
M-U-N.
Okay, great.
Yeah. I'm a student at Sunningdale University pursuing registered nursing. I'm in my second year. We're in the same class with her.
Okay.
Yes. I'm from Livingston.
Great.
Yeah.
The tourist city.
The tourist capital.
Great.
Yeah.
I must mention I like your composure. Sound very confident.
This is how a man should talk. Very calm. And the words were articulated. Not a man. Can't say anything.
No. Yeah, it's very good.
Yeah.
Interesting. So you are both in the same class doing registered nursing. Let's start with you, Gladys. Why did you choose registered nursing? I know there are a lot of programs around.
Inspired by my sister. So when I was done with what they forced me to do, I wanted to be a nurse, and I thought coming to do nursing was best for me, because from just way back, I wanted to be a nurse.
Okay. So when you say you were motivated by your sister is already a nurse?
Yes, she is.
Back home in Chipata?
No, she's in Lusaka.
She's in Lusaka.
Where does she work from?
From UTH.
Okay.
Yeah.
She's a nurse, so that's why she's she also wanted to be a nurse. Like she told me, like, just from
Who told you?
She said she was born a nurse. So I was wondering, I was asking her, but what do you mean I was born a nurse? I was born to be a nurse.
It was just me.
It was just in you.
Yeah, I think my mother would always tell me, you need to be a nurse. You need to be a nurse. You need to be a nurse. Okay.
And you became.
Yeah.
Okay.
Ivan, so what inspired you to join nursing?
Okay. So when I was growing up, I always liked to take care of my siblings, my cousins, and other family members, because where we grew up, we had a large family.
Extended family?
Yes. So anything goes down, they know they can count on me to help, carrying somebody, taking care of a wound. I was young, but I could do that. So I grew up having that care for people. So when I grew up, I found that, okay, what can I do? And I thought to myself, saying, I'm good at taking care of other people, so why don't I venture into nursing? And when I came here, given the opportunity, I found that, okay, no, nursing is a calling. And from my childhood upbringing, I found out that that was actually a calling, and I found myself pursuing nursing.
Okay.
Yeah.
Mr. Kala, what was your calling? Or you never had any?
I think I didn't. Did I have any? I didn't have any. Even in those things we were saying careers day, because I don't know. Naturally, I don't like. I don't know if it's celebrating or attending these events. So I never attended a careers day. If I did, I went there with a uniform, because then I didn't know what to do. But one thing I knew was for sure, I was never going to be like you guys, where I was going to go into health. I was never going to do a health course. So even when we passed grade 12, maybe in grade 10, 11, 12, my friends would say, no, I want to do medicine, I want to do, no, this. The only thing that came to mind was, okay, maybe I'll go.
The police.
No, I might, no, not those things. I might do law, maybe. But then from grade 10, 11, actually what I did was suggested to me by all of my friends and the teachers around me. They said, you can excel in this, you'll be good at this. And I was like, oh, okay, which school? I applied, and the rest is history. But at least you guys were born to be nurses. Ivan is saying, I think just, but I love what he explains, because he says, just from taking care of the home, someone gets sick, they have a wound and everything else, he cleans them and everything else stuff. I think that's a big job I can't.
Yeah, it is. It's not a child's play. No wonder you say it is a calling.
Yes.
You just can't wake up and decide to be a nurse.
Yeah, just like it was a calling for you. Yeah, so...
You know I'm on camera, so maybe not so much.
Yeah, just like... Yeah, so it's good. Quite excited by what Evan and Gladys have mentioned. But also for you, Gladys, also, how has been your experience so far? You are seeing your sister practicing nursing. What were you expecting when you started this study? Is it what you were expecting? What are you seeing? Is there any difference, changes, and stuff like that?
Yeah, I can say, it's different from what I thought nursing is all about.
Mm-hmm.
You know, I thought maybe it's just going to the hospital and telling someone drink 1 in the morning, 1 in the afternoon. Yes, that's what I thought. I didn't know there would be more to that. So it was something that was, when I started, it was a bit confusing. I didn't know how to handle whatever I found. But then I wanted to be a nurse, and I just said, I can do this, and that's what my aim is. I'll do it, and one day I'll become a nurse and wear that white uniform.
Mm-hmm.
Yes.
Oh yeah. So you only wear the white uniform when you are practicing.
When you qualify, when NMCZ declares that you're a qualified nurse and then you get a diploma from NMCZ, then you will get your diploma, and on that particular day even get your white uniform. Then you are now a qualified nurse.
Okay, so you don't become a nurse just after you graduate from your school, you're given that diploma?
The diploma comes from NMCZ.
NMCZ.
Your school probably will just give you a certificate. Then once the results are out, NMCZ now will give you the diploma. So like right now, we're waiting for the results to come out. So when the results are out, those are what's going to determine whether one is now qualified or not qualified.
Mm-hmm. You've read, guys, eh?
Yeah.
Yes.
A good preparation. You have a mentor there.
Yeah.
Ivan, how has it been for you?
So,
Don't forget to tell us about the challenges. Somebody out there might be thinking, I also want to do nursing. But then let them see their challenges. Like there's no road which is straightforward. So what have been some of the challenges that you faced since you started nursing?
So there are things that come new to us. Like to me, there were a lot of things that came new to me. The care that I used to give when I was young back then is different from
what
the
were
one
you using back home?
back home. That was just playing around with my cousins, my brothers and sisters. Maybe one of them gets hurt. They are afraid maybe they are going to be, you know how it is when parents find out you were playing it was unsafe those days. So they were afraid maybe they would be beaten and something like that. So we would try by all means to conceal the injury and stuff like that. So we wrap a small bandage around, just a cloth and something like that. And then I found out that after joining nursing, when we go to the wards, it's different. The care, the sterility. Yeah, you have to
You taught about the types of bandaging, how you're
Yeah.
supposed to do it, the figure of 8.
Yes,
Well, we are
yes.
just used to.
Yeah, but back then we just would.
That's some dirty brown.
Yeah, you just go,
bandage.
you tie it around. Yeah, it's concealed. But now it's different. There is medication. You have to know the types of medication that are needed to be given to different types of diseases, infections, all those. You have to have them in your head. Like there's a course called pharmacology. Yeah, we have where we learn about all the types of medications. So as a nurse, you just have to have that in you. When you come across a patient who comes saying, "Oh no, I have this and this type of symptoms," you know, "Oh no, I need to prescribe this and this." Plus the doses also are not easy to. Yeah, there are some calculations that we need to make also in giving the medications. Yeah, and there are some managements of how we need to manage this type of patient and this one. Yeah, so there are surgical and medical. Yeah, with their different management. So all of those you need to have them in your head. You need to know because there are some emergencies that happen just there and then they bring a patient. It's an emergency. You need to stop the bleeding. Yeah, other patients come with these STIs that we come across. You need to know, oh, I'm supposed to give this. I'm supposed to do that. So yeah, it has been somewhat of a challenge, but yeah, we are coping with it. Yeah, getting to it.
One thing that is interesting, Tendai, if you look at Ivan is explaining and everything else, and he's just a student. So
Yeah.
I'm thinking he's already practicing, and he does all these things.
But I'm just at a good school.
I love the part where he's about to say you're supposed to know all these things in your head, calculate the dosages. And then it's like when you come to the word setup, when you give most of your students like calculate the dosages, when you see a student fails to calculate it, you'll be like, ish, how will she practice? So I start teaching them how to calculate the dosages. But getting it from somebody who's telling you we're supposed to calculate the dosages, it's telling you, okay, this school, it's really doing the best.
Oh yeah. No, let's just also talk about Ivan.
Yeah.
Your experience back home trying to treat friends when they get hurt and everything else, and they lead to you're in your second year registered nursing.
Yes.
The knowledge you've gotten from your first year up to now when you're in your second year, how has that helped and shaped your thinking about nursing, especially offered at this university?
Okay, so when I was starting in our first year, we were being taught about the basics. Yeah. So you find that sometimes we go to the wards, we just have these basics that we learned here. Yeah, but as time goes on, in the second semester, things changed. We're progressing. They are teaching us things that are building from the basics that we have. To tell you the truth, back then when I was starting in the first year, I was just hearing this cannulation, this catheterization. I was always thinking, wow, what is that? And what am I going to do when it's my turn to do that? Yeah, but as I was progressing, here we have the skills lab. Yeah, we have our lecturers teaching us all those techniques and all those procedures. And now I can say I'm able to perform all those things that I used to just see and wonder, like, how am I going to do this if it's my turn? But right now, if they tell me catheterize, I'll do it. With less than 5 minutes,
Now
I'm
you
done.
you even insert the tube.
I insert the tubes, I put up the strapping, everything good.
Yeah.
Yeah, that's just the journey. When I was
Interesting.
starting and up to now, I can perform wonders.
So Tendai, the knowledge is not just theoretical.
No, like when it comes
practical also.
to nursing, you need to be hands-on. And I think this is one conversation I always have with most of the students. I tell them when you come to the ward, if you feel you don't want to be hands-on, you'll be that nurse that when you start to practice, student will be like, there's nothing that she knows. It's because when you were a student, you used to run away. But looking at Ivan, like from his explanation, like he's gone to the ward. When he goes there, he has interest in learning. So he's going to be one of those qualified nurses who knows most of these procedures because he had time to learn and time to put it in practice. So Ivan, like me, I want to take you back now to where you come from.
Yeah,
When you closed school, I'm sure you had to go back home.
yeah.
Did you go now show them like, okay, now
I know how to do it now with
I know how to do the right thing.
So at first, there was that excitement that I had in myself. I'm like, okay, now I have the data and I have the experience. I know what to do when this happens and when that happens. Yeah, so like I have a grandmother back home. Yeah, so she happens to have some hypertension.
Okay.
Yeah. So when I went back home first time, I was like, no, she told me, no, my blood pressure is high. Yeah, I've been feeling this and that. And so I was like, no, Granny, uh, can I ask you a few questions? Yeah, she was like, no, why do you feel stressed? Are you having any stress and anything like that? So she was like, yeah, I'm stressed. I'm always thinking about my business and how I'm going to keep going and providing for the family because my grandmother is providing for an extended family back home. Yeah, so all of those things they used to give her stress. Yeah, hence her blood pressure would always rise when she thinks about it. Have sleepless nights and all those things. Yeah, so when I went back home with the knowledge that I had, I was able to help her with just some therapy. We talk and help her calm down. Yeah, teach her some techniques. Tell her to continue taking the medication that she was being given at the hospital. Yeah. And as at now, as we speak, it's been a year now, and my grandmother has not told me anything about hypertension
Wow.
and all that. Yeah, her blood pressure is at a good level now.
Interesting.
Yeah.
Quite interesting. Very interesting. When you was talking about catheterization, I know the procedure. Eh?
Yeah.
Do you know it?
Yes.
Are you sure?
I know quite a number.
Where do we catheterize?
No. I know the procedure.
Where do we catheterize?
I'll try on Ivan. I think I've answered your question. Yeah. So I know there's first stage of labor, second and third.
Yeah.
I know. Is it what do you call it? Neo care? Is it?
Yes.
I know bed making. I know which other examination is that. I know about 13 clinical procedures.
Yeah.
Yes, I need to check my books.
We are proud of you.
Thank you. I know these things.
We are proud of you.
Gladys, your journey at the university. Interestingly for you also, you had motivation to practice nursing, to study nursing. What were your expectations? Is this something that is different from what you are seeing now, especially when you're at this university? What has been your journey like up to where you are now in your second year?
So this could be, you can tell us both sides, like theory-wise, like being in class, and your experience on the ward.
Okay. It was different because I came. This is a fresher, yeah, coming to college, and you don't know what really nursing is all about. Then you're given 9 courses plus OSC. So you have to balance in class and OSC at the wards.
What's OSC?
OSC is the practical area.
Where you go at the facility?
Yes.
Great.
Yes.
Okay.
So you have these 9 courses that you need to study, and also you have to manage going to the wards. So my experience in class, I was having a challenge in the first year. I didn't know myself. Like, how am I going to manage these 9 courses that I have? No. And at home, I come from a house where my dad is strict. You fail at your own risk.
Okay.
Yeah. So I had to, the time management, I had to know myself and how I can manage my time of being in class in the practical area. At the wards, in the first year, it's tricky because you don't know most of the procedures. Yes, and you're given to do a simple procedure, you're there shivering, you don't even know where to start from. But then, I just got this courage from my sister, like, if she did it, I can also do it. From there, I was open and to ask where I'm not I'm not confident. The things that I'm not confident with. And we had nurses who used to teach us.
And some who never used to teach you.
Some were not even interested.
Or some nurses were not even interested in teaching new students. You have some who are not interested.
Yes.
Madam, are you interested in teaching?
I always say, I'm interested in teaching you when you're interested to learn. I'm not going to pull you to come and tell you, come, I teach you. But if I'm doing something, I'll say, students, come and learn. Those who want to learn, they'll come and learn. Those who don't want, you leave them. Because at the end of the day, it's them who wants to learn.
Isn't it that when they come to the hospital for practicals, then they are ready to learn?
Not all of them.
So what are they coming to do there?
I think they will be in the best position to answer.
Interesting. So your sister also has been at the helm of helping you excel in this nursing. I can tell Tendai from the two as to why this university, Sunningdale University, scoped the Smart 24 quiz. You guys are the winners, are the defending champions of the Smart 24 quiz, which was organized by Elitrasmart Medical Supplies Limited. Interestingly enough, last year when you guys won this trophy, there was massive feedback from stakeholders and cooperating partners, and of course from other institutions alike, to participate. But the interest was beyond Lusaka. It was coming from different provinces. So when Elitrasmart, the organizers, and by the way, they are the main sponsors of this podcast, where we are sitting and having this chat. When management sat, they sought and resolved of hosting a national event. So you are defending
The trophy.
this trophy, the trophy you won in 2024. First position winners, Sunningdale University, against a wide range of schools. By anticipation, we should be expecting around 50 schools to participate in this quiz. Even before we discuss about, as we now start actually discussing the Smart 25, Ivan, how do you feel that your students, or how do we call them, your seniors won this trophy and they have left it in your hands? How do you feel just about, how were you feeling last year, and how do you feel that this trophy is sitting at your school?
So, by the way, thank you to the ones that won. Yeah, it was very nice and very pleasing to find out that our school is the one that scooped the trophy. Yeah. So we also want to continue the same hard work that those before us put in. Yeah. We have to make sure that this trophy stays with our school. Yeah. We would really want to be the champions again. In fact, we are going to be the champions again this time around. Yeah, we prepared last time, and this time again, we are preparing to bring this trophy back home.
Okay.
Yes.
We will discuss more about those preparations
Mr.
because the
Kalau,
competition is stiff now.
can you just listen to his voice? Can you say that we'll bring this what?
This trophy back to the school again.
You can get that! Can you say that in your voice?
I say what now?
What you said, we'll bring... Say it in your voice again.
We are bringing the trophy back to the school again.
Okay. But we are bringing the trophy back.
Listen to your voice, and then listen to his voice.
No, he has a very good voice.
Yes.
You like him, eh?
A commanding voice.
Even go with Tendai. I think she likes you this one. Yeah. Gladys, how do you feel? You're seated with this trophy.
It's an honor, yeah. And we say thank you to our seniors. They made a way. They showed us how things are supposed to be done, and we don't want to let them down. We're still bringing this trophy back home. Yes.
How much preparations, Ivan, are you putting into the preparations of the Smart 25, because it's like we mentioned, it's not a child's play. It's not one of those quizzes where you come unprepared.
Yeah.
It will be the survival of the fittest. It's a 3-day event where schools will be knocked out. Believe you me, it will be shameful, to say the least. If the defending champions, it happens in the world of football, but we do not want to see what happens in the world of football.
It happens always Arsenal losing.
No, Arsenal is great actually. One of the best teams
Really?
in France. You watch football?
Yeah.
Yeah, Arsenal.
Don't support Arsenal and Manchester.
No, but Arsenal is better. Arsenal always, I think the last 3 years have been second. Better team in the English Premier League. I support Arsenal.
But don't
and
support
I
Arsenal.
confidently speak as an Arsenal supporter. And not just as an Arsenal supporter, as someone who is very objective.
Yeah.
And
Ivan, don't support Arsenal. We move.
No, Ivan. Which team do you support?
PSG.
PSG.
Yeah.
Yeah, PSG. PSG won against Arsenal in the UEFA. It was quite an interesting game. But anyway, Arsenal is winning the 2025-2026 trophy. Anyway, just as Sunningdale is wishing also to retain the trophy.
Yeah.
But I was saying, you are facing a wide range of schools.
Yeah.
From all different provinces across the country. How much are you putting in as students in terms of research preparations so that you adequately prepare defending this trophy against the other schools?
So, last time, the quiz was only within Lusaka.
Mm-hmm.
Yeah. And this time around, it's national. So we are going to have more competition. Yeah. So we need to pull up our socks this time around. Yeah, we did good. We brought the trophy home. And this time we want to keep the trophy home. So our preparations this time, we have to up our game. Yeah. So in upping our game, we have study groups, which we are all in the same study group with her. Like I said, we're in the same class. So yeah, we have a study group. After class, we remain at least for 2 hours. We discuss. We also go back to our past papers. We're using some past papers to refer to what can be asked in the quiz. Yeah. We also are doing deep research. Like you can see, we have a nice library up to date.
Oh yeah,
Yeah.
I can see.
Now our library is up to date, so we come here, we do some research, we spare some of our lunch time. Yeah, we come here, we do some
Maybe
research
lunch
in
is
the books.
sparing.
Yes,
That
yes.
is not me.
So this is
No wonder you're supporting Arsenal.
this time around the preparations are intense because we are facing other schools that have been in existence for a long time. Yeah, they are household names, I might say. So yeah, we want our school to also be a household name, saying no, they are the winners. Yeah, we are trying to win this time around. So also we have our lecturers that help us with any questions where we are not clear. Yeah, and if we need any help, we go to our lecturers, we ask. Also these days we have social media, so yeah, we also do some searching online. Yeah, we get some answers, we clarify with our lecturers because they have more experience.
Interesting.
Yeah.
That's quite a lot in that research.
Yes,
That's
yes.
quite a lot in that research. And I believe you are preparing adequately.
Yeah.
And we can only wish you the best with those preparations.
Thank you very much.
Gladys, you are part of the team that Ivan has mentioned, doing massive preparations adequately, even sparing lunch, which I can't. Lunch is lunch. Like,
Because you're
we can do
Arsenal.
after hours. We can do after hours, and
I can't do after hours.
Yeah. So, how does it feel for you to defend this trophy, but also to be part of these preparations?
Okay, so these preparations are also helping me when it comes to the exam that I'm supposed to write. Yeah, so while studying for this quiz, it's also helping me as in at the end of nursing, we're supposed to write the final exam by NMCZ. So it's while we're studying, we're not just studying for the quiz, we're also studying for the exam that's coming. That's also helping us to revise. Yes.
Ah, interesting.
So how do you feel like this quiz to you? So now like this question is for both of you, but then I'll use to you, but meaning the both of you, right? How do you feel is beneficial to you as an individual, the Smart 25 quiz?
Okay, so the quiz, it's very beneficial to me, as I can say, because when I go for the quiz, I'll gauge myself saying, okay, no, I failed to answer such questions and I managed to answer such questions. So if I am able to answer such questions, I am ready for the exams. But for those that I have failed to answer, I know that I need to revisit them so that I prepare adequately for the examination. Because GNC exam is not
Child's play.
yeah, it's not a child's play. You really have to be ready. So the quiz helps me prepare also for the examination. Yeah, my studies are different from when I started and from now when I know I'm going for a quiz. So I have to prepare adequately. I have to put everything together. I have to manage myself. I have to have self-discipline, knowing that, okay, now I have a quiz. So let me prepare and make sure I put in time in my preparation, because I'm not only preparing for the quiz and bringing the trophy home, I'm also preparing for the examination that is coming, the final, the GNC exams that are going to set my future. Yeah.
And interestingly, as you prepare for that quiz, I think that goes to the same of you. The organizers have set aside a little cash for some best performing. Is it best performing
Best
students?
performing students.
And I think the winning school, the best performing student walks away with I don't know if it's a 2,000
Best
kwacha
performing students
laptop?
walks away. Best performing students walks away with a 10,000.
or a 10,000.
Best performing student, 10,000.
12,000.
Then the best performing school that comes out number one walks away with a 30,000. So imagine you are the best performing student, you are the best performing school, and then you have the best performing lecturer, meaning you are getting how much together? 45,000.
Yeah. So it's quite interesting. Aside from the academic benefits, there is also some a little bit of cash involved. Yeah, but of course the overall the motivation is to see that students are well equipped with what is happening in real practice. So you have the theoretical knowledge, and of course for you to have the practical knowledge, so that and the technical know-how, so that when you start practicing nursing, you continue according to this profession's ethics and standards, and you continue to be good nurses. The two of you have a very good base. She has a motivation with her sister, telling her on how to go about it. Very good. You have a very good base of just starting from the grassroots up to where you are now. And of course, you already you've managed to make a grandma now at ease. She's not panicking now with stress and everything else.
Yeah.
Well done. So let's also just discuss as we continue our discussion. I want to also just trying to find out on from you, Gladys, the preparations you are doing. What and looking at what your seniors achieved, and in achieving that, they also achieved even something beyond. We were told that they were amongst those ones who were amongst the best graduating students. What does it mean to you, who is about to participate in the Smart 25 national quiz?
Okay, so that's also like a motivation. So it's also setting. It's also telling me that despite me participating in the quiz, That will also help me for my exams that I'm preparing for. So this quiz is like it's telling me to gauge myself, yeah, more like evaluating myself. Like, am I ready for that exam? Yeah. So like Ivan said, the questions that I won't be able to answer, it means I'll have to go back and read more, research more, and understand more about that. But also, the point where they also came out the best, it means they never, even after the quiz, they never threw their books. They still went back to their books and they had to start more and more.
Interesting. So meaning even after the quiz, you go back to studying more and more. Thank you. Our dear viewers, remember this podcast is being sponsored by Elitrasmart Medical Supplies Limited, your number one provider of healthcare attire. So, like we always say, if you are a nurse out there or a student nurse from whichever location, Elitrasmart has branches across the country where you can order your uniforms and they will deliver it at your doorstep. So get in touch with the numbers being provided so that you can be serviced nicely. Ivan, let's talk about you and the motivation you get from your seniors who graduated as one of those best performing students. How does that speak to you, and how does it even give you zeal to even wanting to participate in the national quiz, Smart 25?
Okay. So what my seniors did is excellent, I might say. So with them winning the trophy, bringing it home, being part of the best students even here back at school, it just shows me what standards they have set. Those standards, I have to exceed those standards also. I do not have to be below, because if I am below, I am not going to be able to even bring the trophy back home. Yes, I have to go beyond those standards. So I think in my preparation also, I have to up my game. I have to pull up my socks, saying, no, I have got standards to exceed. So for me, I think I just need to exceed those standards, because this time around, it's the whole country that is involved.
Yes, it's the entire country involved.
Yes.
What schools are you looking towards seeing there?
So there's one school from back home. Yeah. There's two, in fact, from back home. That
they're all coming.
Yeah,
We had good reception from